So your doctor ordered a calcium score for heart health. What in the world does that mean, and how often do you need to have it repeated? I'm Dr. Kevin Passero, and those are the topics we're going to cover in today's video. A calcium score is a test where a CAT scan machine uses x-rays to take pictures of your heart, particularly the blood vessels that surround your heart. And when plaque forms in those vessels, as it gets older, the body tries to calcify it as a way of healing it. And the x-ray beams bounce off the calcium and it makes it a white color, just like what your bone looks like when you get an x-ray. And what it tells us is if there's calcium deposition going on in the arteries around your heart, which suggests that there is heart disease. So that's what it is actually doing. Now, calcium scores have great value in clinical outcomes, but they also have some downsides. So one of the great values is that if a calcium score shows any kind of scoring, it definitely means that plaque formation has been occurring. But what we also have to understand is that calcium scores only can measure old plaque. New plaque starts off as soft plaque. It's kind of more like, it's kind of gross, but that stuff right under your skin when there's a pimple that's about to pop, that's sort of more what a soft plaque is. And that won't show up from x-rays because it's not dense enough. As the body tries to heal and repair that plaque, it deposits calcium, and we get these calcium deposits. Now, here's the biggest problem with the calcium score. You can have a 0 calcium score, but quite advanced heart disease. And I've seen this many times in the clinic where people have a 0 calcium score, but they have a 50 to 60% blockage of one of their coronary arteries because it's all soft plaque. Now, if that calcium score is to be taken in 5 or 10 years, you might find some calcium deposits and see some evidence, but the plaque will have gotten so large, or even worst case scenario, ruptured and caused a heart attack by that time. So while they're super useful and they are good predictors of your heart attack risk for, let's say, the next 10 years, you have to understand their shortcomings. Now, if your calcium score is high, that's a big warning sign, because that means that the process of plaque formation has been going on for really quite a long time. Enough time that there's a significant amount of calcium. And when we start to see calcium scores over 100 or 200 or 300 or 500, sometimes they're up into the thousands. As soon as we start getting over 200 or 300, we're really concerned that there's some advanced cardiovascular disease. And usually those people are given additional studies and pushed into pathways of intervention. My biggest concern is the people that have the calcium score of 0. Now, one thing that we do know is that if we do the right therapies, if your blood pressure is high or your cholesterol is way too high or your blood sugar is way too high, and you get those under control, the body can actually reverse the plaque, which is great news. So everybody thinks, okay, I have a calcium score that's a little elevated, I'll go ahead and change my diet or take supplements, or if they're taking the recommendations of pharmaceutical interventions, do that, and then I'll repeat my calcium score and I should see it all go away. And that's not exactly how it works, because that calcium is sort of like a scar. Once you have a bad cut and it scars over, that scar doesn't go away. It's there forever. And that calcium deposit isn't necessarily something that's going to resolve. But imagine this, for every calcium deposit that you have, there is going to be some soft plaque surrounding it. So the purpose of doing plaque regression is to actually make the soft plaques, which are the dangerous ones, go away and resolve. And so that's why you won't see a decrease in your calcium score, even though you may be reversing plaque that's there and actually reversing your heart disease. So that's important to know. Now, the other thing that people get really confused about is sometimes they start on these therapies and they go back and get a repeat calcium score and the calcium score goes up. And because the general understanding is that higher calcium scores mean more heart disease, they're incredibly discouraged. But there's more to the story. You see, as the soft plaque starts to heal and regress, one of that processes of healing is to calcify it. So for example, in one patient that I recently had, their initial studies, we didn't do a calcium score, we did another more advanced test that I'll talk about in another video, where we actually saw about a 50% blockage, and it was all soft plaque with a 0 calcium score. After about 3 to 4 years of treatment and follow-up with testing, the blockage was only about 15%. So it went from about 50 to 15, and it had fully calcified. So whereas 3 or 4 years ago, their calcium score was 0, but their soft plaque was very dangerous, now their calcium score was a bit elevated, but the plaque formation was much smaller and it was stable. It was like a healed scar in their artery that would never rupture or never put them at risk for a heart attack. So that's a really important concept to understand when you're doing calcium scores. The other thing that some people don't understand, and even some doctors don't understand, is calcium scores aren't to be repeated very regularly. Most doctors don't advise, at least the cardiology oversight committees, don't recommend a calcium score more than once every 5 to 7 years. So it's not like you get a calcium score done and then you start on your cholesterol lowering or blood pressure lowering therapies, and then you get it done a year later to check your progress. You have to wait several years, and that's for several reasons. Number one, because of the way the calcium score can and cannot change, as I just explained. And also because every time you get a calcium score, you are getting some radiation exposure from the CAT scan machine. And we do want to minimize radiation exposure wherever possible. So I hope that was really helpful and that was clear and concise. We'll be talking about these different topics more in later videos. This is a new channel, so if you're interested, please subscribe and comment or like the video. We'd be happy to curate and answer questions for you. This topic actually came in on a direct question that came in from a patient that I was answering for them earlier today. So I hope that was helpful. Thanks again, and we'll talk to you soon.